close that. All right. Hello and welcome to the kickoff webinar for Digital Health CRC's Aged Care Impact Series. I'm going to start off with an acknowledgement of country and we'll just jump into some housekeeping after that, and then I'll hand over to Megan. So in the spirit of reconciliation, the Digital Health CRC acknowledges the traditional custodians of the country throughout Australia and their connections to land, sea and community. We pay our respects to their elders, past, present, and extend that respect to all Aboriginal and Torres Strait Islander peoples today. So just a little bit of housekeeping. Today's webinar is being recorded, as we've already started that, and we'll be able to share that with you within the next few days. Please pop all your questions in the chat and we'll do our best to answer all of them at the end of Megan's presentations. And if you can, please keep yourself on mute just to avoid any disruptions throughout the presentation. But for now, I'm going to hand over to Megan Snewen, our program manager, who's our strategy aged care lead, and she's going to run you through the rest of the presentation.
Thanks, Sam, and thanks for everyone joining us today. Good morning, good afternoon, and good evening, in whichever time zone you're in. My name's Megan Snewen, as Sam said. I'm the Senior Program Manager here at the Digital Health CRC and the Aged Care Strategy Lead. And I'm coming up 4 years at the Digital Health CRC. I'm joined today on the call with some colleagues. So we've got our CEO Annette Schmidi on the line, who is a champion of this work and supported it since its inception from her Bupa days. We also have Dr. Claire Morgan, Chief Executive Officer and Deputy CEO and Director of Research and Commercialisation. We've also got Dr. Isabel Freen on the call, Director of Digital Health Integration, who is deeply ingrained in this work and working side by side with me, and joined by our technical advisor, Tim Blake, who is advising us for this initiative, and Managing Director of Semantic Consulting. So we have a number of other colleagues on the call, so give us a wave, team, but I won't introduce you all. So the agenda for today. So essentially today what I want to do is briefly outline the work that we've done to date as part of our flagship project focusing on the digital transformation of aged care, and talk to you about the investment that we'll be making over the coming 6 months to build out a smart on FHIR quality indicator app. I'll start off with a bit about the Digital Health CRC and some background, and then outline our rationale and plans for the app demonstrator. And at the end, as Sam said, we've got a substantial amount of time quarantined for reflections, comments and questions. So for those who haven't heard about the Digital Health CRC, or the Digital Health Cooperative Research Centre, we are a government-funded, not-for-profit organisation, time-bound, time-limited for 7 years. We're funded out of the Department of Science and Industry. And our mission here at the CRC is to advance digital health innovation. We do that by uniquely linking our 60+ partners across academia, industry and government, and accelerating research implementation by generating the evidence base for what works. Over the course of our 5 years now, we funded a large amount of projects, including this one, which I'm deeply passionate about and here to talk to you about today. The initiative is a fairly bold one, and a step towards addressing some of the aged care's biggest challenges. I don't think the challenges would be lost on anyone that's joined the call today. That is the lack of standardised, interoperable and reusable data. So what have we done to date, and sort of a bit about the why. This initiative is rooted in the findings of the Royal Commission into Aged Care Quality and Safety. That noted that Australia's aged care system was fragmented, it was inconsistent, it lacked transparency. So we know that recording data is an issue. There are multiple systems, there are multiple ways of recording care. And once it's been recorded, it's difficult to share that data for reporting purposes. It's the inability to share the data in an easy and meaningful way that is an issue that we're trying to solve. So the Commission issued a clear call for reform. We believe that at the Digital Health CRC that digital health underpins this and plays a critical role in fixing this issue. So without the high quality and standardised data, I think we'll be circling the drain trying to improve care for a long time to come. We won't be able to benchmark or give people confidence in the system. So where did this start and what have we done so far? On this slide, you'll note our partner logos. So back in 2019, we funded what has become a 5-year program of work and one of our flagship projects, the Aged Care Data Compare. So with our partners, we've generated a lot of evidence and outputs. This slide probably underrepresents that body of work, but I will call out some of the project highlights. We've created a secure de-identified aged care data repository, which exchanged data based on HL7 FHIR protocol. And via an extensive industry consultation, the team from UQ developed and validated 25 industry-led quality indicators. The Aged Care Data Compare project realigned clinical workflows with the quality indicator calculations, and also set about building dashboards and decision support tools, including developing and trialling a smart on FHIR app. So the app in its current form aggregates data and calculates QIs, displaying them in real time to the person doing the clinical assessment. It then makes that data available to care planning and monitoring and look back over time to compare QIs from quarter to quarter. That same data is then transmitted to a research repository, so sort of emulating a similar endpoint to as the B2G. We were deeply lucky to have engaged the partners that we did for this project. We know that there was benefits, but we want to acknowledge the significant contribution that they've made and the collaboration, because that was key to the success of this research. Regis are now harnessing the power of that data to uplift their quality, and they've streamlined and brought efficiencies to the process and way they collect data, which they've estimated at a reduction of about 50% in administration. So for all the partners involved, the project has collected and generated along the way critical evidence base in modernising, mandating and standardising data in the aged care sector. It's demonstrated the art of possible and what you can do when you standardise and reuse data effectively. The solutions created under ACDC are ones that can be adopted more widely into the sector. And so now what we're looking to do, and for the next phase, and what we're here to talk to you about today, is scale and how we'll go about building out this app to scale. Okay, so what are we intending to do over the next 6 months? What we're aiming to do is build a production-ready solution that will enable nurses and carers to complete a standardised comprehensive assessment of resident, which can support the generation of the QIs and pre-populate then care plans and other documents such as transfer summaries. At the end of the process of capturing that data, what we want to do is aggregate that and submit it to the B2G for reporting. The Smart on FHIR app will be based on the FHIR long-term care facility assessment instrument. It's one of the few evidence-based comprehensive assessment tools available globally. And so we're looking to leverage that. We can see where the benefits for this app lie and how powerful it can be. We're looking to plug into existing aged care software to pre-populate data and doing that via FHIR, so no massive rebuilds. We're looking to calculate those QIs in real time, which will enable benchmarking, align that with clinical workflow, and as I mentioned, to reuse that data across the settings. So moving from residential aged care facility into in or out of hospital, and sharing that with a discharge summary. Most importantly, we're looking to demonstrate to government how possible it is to introduce a functional assessment for older persons without disrupting the whole sector on its head. We know that the sector is stretched, so we're looking at the technical feasibility of doing that. The approach we're taking reflects international best practices combining inter-array, which is evidence-based and deployed in multiple countries, New Zealand, Singapore, Canada and others, North America, etc., and combines that with the emerging modern standard, which is interoperability and standard of FHIR. We're looking to create a flexible and scalable app based on evidence-based outcomes. So why this matters to us and what is our end game? So our goal is obviously not to add to the pile of tools that are available. It is system-wide transformation. We want to build it once and deploy it or connect to it many times. We're looking to provide government with confidence that the data that used for calculating quality indicators is standard, and that introducing a standardised functional assessment framework is technically feasible. We're aiming to support providers in optimising care and operations and streamlining their workflow to focus on what really matters, which is giving the care and not reporting on it. Other things we're aiming to do with this app are to support the creation of an aged care minimum data set and to enable the standardised functional assessment framework to be implemented. So we're aiming to do this by the end of the year and to showcase demonstrations to government and industry alike before the end of the year. It's ambitious, but we're hugely excited about the opportunities that lie ahead. I'm going to hand to our technical advisor, Tim Blake, who will walk us through a bit more about the benefits of the app and also maybe talk to the opportunity for aged care vendors and health data interoperability. Over to you, Tim.
Thanks, Megan. I'm just going to present a single slide, but I think it'd be good to note any questions because I think we're going to have plenty of time to answer people's questions as well. Worth noting, I think that this piece of work, the concept for this project arose from both the ACDC project, which has delivered some really exciting outcomes, but also a fairly comprehensive landscape scan of the current state to understand particularly how functional assessment is operating. So the need for doing this work has been informed by quite a lot of work that we've undertaken previously. I really genuinely believe that this is potentially game changing for the way that we handle data here in aged care in Australia. And the project really can bring together a couple of, I think, very important pieces. So one is the work that has been occurring in the FHIR space. Many of you, I think, would be aware of the Sparked FHIR Accelerator and the work that it's been doing in the healthcare domain. It is starting to think about, at least at a conceptual level, aged care. And obviously there is I mean, recognizing that there is difference here, of course, but there is some overlap with some of the clinical components, and it would be good if we had consistency in at least some of the relevant clinical components of aged care. But a lot of work remains to be done to bring FHIR standards into aged care. But the other piece that comes together here is InterEye, which is not a standard per se, but if you like, it's a de facto standard, which is used in many countries around the world and kind of functions as a standard kind of logical model for aged care data around the world. And one of the strengths of InterEye is just the 20, 30, 40 years of research that has gone into it and the data items that it uses the way it can do risk adjustment and some other things that I think are really quite challenging for us here in Australia. And InterEye has been looked at extensively by organisations like the AIHW as they work to start thinking about a national minimum data set, and that's been something that I think they're very supportive of. So in terms of the benefits and how this is game changing, the solution I think can really add value to all parties. And I just wanted to kind of talk that through. So from an aged care provider perspective, I think it will allow us to, number one, kind of drive adoption of a more standardized functional assessment framework, recognizing there are many ways to do this already. But if we are to move towards a more standardized way of doing it, I think InterEye is an excellent way to consider doing that. Nothing about what we're doing here is mandatory, nothing is mandated by government, but we believe that this is a capability that many aged care providers already have the desire to adopt. And we think at the same time, by gathering data in this fashion, we can automate to a large degree submission of at least a decent subset of quality improvement data to government via the B2G APIs and reduce what is quite significant manual effort in that process. Today, that manual effort also results in some error and a lot of work, and we hope that that can be valued to aged care providers. In terms of the software vendors in the aged care space, we think adopting Smart on FHIR or Smart App Launch as a capability is not only an investment for this project, it's an investment that's much longer term. We are going to see the growth of Smart on FHIR applications as a way of rapidly enriching healthcare software, aged care software. And I think we will see in the not too distant future the emergence of national repositories of conformant apps that can be used in different places. For vendors to have that capability, I think will be very valuable because it will offer a mechanism for using standards to adopt functionality on a rapid basis. And that's really where we're going here, to allow the rapid adoption of the InterEye LTCF assessment form. From a government perspective, we believe that this is the beginnings of driving some greater standardisation in the data space, recognising that's a much bigger problem than just this project. But we also think it can increase adoption of B2G APIs for submitting QIs. And also for residents, ultimately, our aim is to stop asking the same questions over and over, using a workforce that is already stressed and not having to have them do the same tasks, which are relatively low value, over and over, but rather be able to use data again and again throughout the life cycle. Many of you would be aware of the collect once, use many phrase that was used in the aged care digital and data strategy, and I think that's a very worthy goal. And I think this project helps move us another step in that direction. Obviously, our longer term desire is to get reuse across the entire aged care data lifecycle. In this case, we're just looking at a specific piece of that, and I know many other of the people on this call are working towards that very same goal in other ways. But I think InterEye is a healthy step in that direction. As I said, InterEye is not a standard per se, but is functioning as a de facto standard around the world and offers not just the prospect of reuse within Australia, but comparison across and outside of our national boundaries as well. But we want to go beyond just collect once and use many and sort of apply that concept into the build of new functionality and really take what is a not insubstantial piece of functionality and build it once and deploy it many times. What we don't want to have to do is mandate a piece of infrastructure, a new way of doing functional assessment, and then tell everyone they have to build it. The aim here is to build it once using a Smart on FHIR app, to build in some of those complexities of the calculations that need to be done within that, to do it right, to do it well, and then to have the opportunity to then deploy that into multiple places, into multiple vendor systems, deployed into multiple aged care providers. We want to make sure that there's still flexibility within that, so that there is the opportunity for vendors to take what is built in the centre if they want to. Again, this is not something that will be mandated at any time in the future, in the obvious future, but to take what is produced and to customise that to a degree in terms of its user experience and user interface. And those are requirements we'll very much be trying to think through as we build this. We say here plug and play. I think that's obviously a grand goal. I suspect the reality would be that it integrates relatively easily with systems that have smart app launch. There will still be some data mapping work that would need to occur between existing vendor systems and the FHIR implementation guides that get defined as part of this process. But again, I think that's a step in the right direction and work that needs to be done at some point. Ultimately, we really want to align to these FHIR standards and to bring Inter-I and FHIR together into a common world. We recognise that means some additional work for Inter-I in terms of alignment to clinical terminologies, and we'll try and showcase some of that within this project to the extent that we can, whilst retaining a degree of flexibility for vendors that do choose to deploy this as a piece of additional functionality within their systems. So that's probably raised a few questions. Very happy to answer them in the time we have for questions, but Megan, I'll hand back to you for now. You're on mute, Megan.
Thank you. That would be interesting. So yes, thank you, Tim. Appreciate that. Our mission is clear, and the window of influence is now. So you can see the call to action. We'll need to do this together, and to create some groundswell required by the sector. We're inviting you to be on this journey with us, and are looking to actively build a community to support this initiative. And we'll be holding monthly seminars from now on. So come along to the next session. It's on the 24th of July. The QR code is on the screen there. And bring other colleagues or sector friends. A bit about between now and then, what we're doing is we're in the process of securing a developer to build this, and having conversations with already in train conversations with several providers and vendors who are looking to integrate this, and facilitate some real world testing in development environments. So if you're a provider looking to participate in the pilot, or a vendor, or a policymaker or thought leader interested in discussing the impact, and or talking about what's next, we'd love to hear from you. And there most definitely is a role for you, so please reach out. This project's being run in an agile sprint-like fashion. So at each webinar, we'll be looking to showcase what we've built to date. And in the next session in particular, we'll be sharing sort of the concrete opportunities and a bit more detail about how to get, what are the options to get to be involved. And as I said, we're hopeful to announce our developer, which will be very exciting news. Thanks, Sam, for popping that in the chat. Really to digitally transform the aged care sector requires a new way of working, and that's sort of where we're going with this collective approach, and one that works for us at the Digital Health CRC, and we've seen working with government and industry collaborating on a consensus-based philosophy. This is an opportunity for aged care community to help shape interoperability in the sector. So let's build a data-driven aged care system together. Nothing else more from me at this point, but just to say thanks for coming today. Sam, I will open the floor for Q&A, reflections, feedback, comments, and invite my colleagues, Isabel and Tim, to jump in and assist with any questions.
Thanks, Megan. We've had one from George asking, has this been introduced to DHDA to be used for the GPMS and the new assessment system, and considered using it in future versions of the GPMS?
I think probably one way I might jump in here, Isabel Freen. George, great question, thank you. These are all the conversations that we're wanting to be able to have. The department is and has been a fantastic supporter of the Aged Care Data Compare project and is aware of many of the outputs from that project, and we've had a number of conversations with them in relation to the government's platform for interacting with providers. What we're not wanting to do is interfere with the current roadmap that the department's working to. What we're wanting to do, building on the evidence base coming out of Aged Care Data Compares, is to really sort of finish the work we started by developing a scalable demonstrator. And in that way, we hope to provide a useful exemplar way forward that could indeed be used as part of the department's B2G. And the reason we're working to this tight time frame is probably reasonably obvious to anyone involved in the policy cycling. If we can start through these monthly webinars to demonstrate what's happening, how it's working, invite your input on use cases. Can it do this? What if it could do that? Essentially to build something that can give confidence to policymakers around the directions that obviously that they're working through to shape an aligned digital aged care system. But great question, George, and any assistance you can help provide in ensuring we keep these conversations wide and open, gratefully appreciated.
Thanks, Isabel. And if anybody has any questions, thoughts, Kate's just given the perfect example. You can use the little chat function to raise your hand, and then we'll bounce to you. So take it away, Kate.
Thanks. The new Aged Care Act comes in on the 1st of July, and through that there is reporting obligations, and we're meant to give real-time access to regulators of quality data. How can we, like a lot of the providers at the moment, including Ryman, where I'm on the board, we're trying to scramble to sort of configure how we change our current data capture to meet those obligations. How do we engage and see how this technology can actually help us do that? At the moment, we actually don't know what the government's requirements are, even though the Act comes into force in 4 days. Is that too big a question?
Well, I mean, go ahead, Michael.
I was going to say, Kate, they've actually moved it out to the 1st of November now.
Oh, thank God. Thank God. So there was a lot of anxiety. I have yet to be informed of that, but I know there was a lot of anxiety about how we were going to, and it was particularly these obligations, the reporting obligations, which, we're all scrambling to find a more efficient way because, as you know, our workforce is diverse. There's a lot of effort that we're trying to manage these businesses as efficiently, or these services, frankly, as efficiently as possible. And this is another layer of administration, and to be able to do it digitally and to be able to get access to a data set where we can actually predict healthcare needs for our population would be amazing. So I'm assuming AI will be incorporated in the future at some time.
It will be. It probably, as you're aware, the government has a whole strategy around how do we support providers, and that was to be that's now moved to November 1st. There's a BDG gateway which has been developed. There's a whole heap of strategy around that, but I can get you in contact, or I'm sure the organisation itself is aware. Government has fortnight, I think, updates online and that. So I'm happy to send you anybody's links so you got access to those.
Okay, great, thank you.
And from our perspective, sorry,
could I just add one thing, Megan, if that's okay? So it's a great question, Kate, and I think the other thing that we have in mind, and this won't be tangibly helpful to you right now, but just in terms of the design principles that we're trying to apply here, what we want to see aged care providers do is establish those clinical quality improvement feedback loops using data so that they're really effective. And if we do that well, then have the quality improvement, quality indicators reporting to government be a natural byproduct of that process, not something that is just a massively onerous problem on its own, but something that just we can just partially solve that problem. So we're thinking about it in terms of how do we present some of this quality indicator information back to aged care providers so that this is not simply just reporting to government, but it's actually adding value to you guys as well, and try and kill those two birds with one stone, because we think the information will be of higher quality if you're able to utilise it operationally in the care that you deliver. Yeah,
that would be awesome.
Yeah, and I think, and I'll just add to that too, Kate, we are aware of the sector fatigue and the amount of change that's going on. So we have structured the project and approach to be able to deploy this into development environments with vendors, so that we're not touching production environments. And I think that as an approach will really help us to be able to facilitate testing in a way that isn't too taxing and time consuming on vendors and providers and the like.
And I think the other thing that we kind of realised as we went about the process of conceiving of this idea is that government mandates have been quite exhaustive, and we could see providers and vendors both incredibly stressed. But what was July the 1st is now November the 1st. Who knows whether that will shift again. But the last thing we need is another mandated solution. We actually want to create something of value that people want to adopt because it has value, not because government has said we have to do it. And so I guess that's sort of a goal we're setting ourselves here, that does this add enough value to all the parties involved so that people will go, government hasn't said we have to do that, but hey, we could, and it will add a lot of value to the efficiency of our workflows.
And I think vendors are looking providers, are looking for solutions, at the moment of how, so it is very timely, which is great.
Sam, I just noticed that Vincent's put a question, and he's from are you from Raysoft, Vincent?
Yes, I am. I am from Vitec Raysoft in Finland. Hello,
that's
everyone.
right. Well, welcome, and it's great to have you here. And we're well aware of the extensive work that your software company already provides in supporting aged care providers across Europe and a number of other countries. This is the first of a series of webinars or really conversations. We want to bring everyone along the journey. So the person you need to talk to is Megan and Tim. They're leading the project through these monthly conversations. We'll be providing progress and update. We have had a couple of conversations with your colleagues, and be really keen to have Raysoft involved. Obviously, from a digital health CRC point of view, we want to demonstrate and see Australia as the sort of leader of the pack in adopting Smart on FHIR in aged care. But there are obvious opportunities internationally, not the least with our neighbours in New Zealand, where that is already a mandated approach to functional assessment, but where interoperability to support providers in the way that we're talking about does not yet exist. So we see opportunities there, and indeed partnering with organisations like yourself. So I think get in touch directly with Megan, and we'll bring you along on the journey, and we will learn from you as well, obviously.
Thank you very much for your information. Thank you.
I think anyone looking for more technical information, please come along to the next session. We will be in a better position by then to be able to outline how the sprint program might be is going to take shape. We'll be in the thick of it by August, because as Megan said, the plan is to operate on fortnightly sprints. But through these monthly webinars, demonstrate value as we're progressing, and we will also at some point be inviting you to critique the use cases that we're proposing on testing, and potentially shape or influence, or even, if necessary, change those. So we're wanting to do this in a truly open and meaningful way, and if there's other intel, other activities in the sector that you're aware of that perhaps you think we're not aware of, please relay those to Megan, because we want to do this in as constructive a way as possible, given all the other activity happening both across aged care and the whole digital health space.
Great, thanks, Isabel. And yes, Kate, please share the invitation to the webinars with whoever else may be interested. That link is just, if you scroll up just a little bit in the chat, you can find that there and you can pass it on. We'll also do a couple of social posts and whatnot as well, so you don't miss it. But if there's nothing else and no other questions, I might just hand back to Megan just to say her final words and close up the session. But on behalf of Digital Health CRC, thank you for joining us, and we hope to see you on the 24th of July. Megan.
Thank you, Sam. Yes, I've just put my email address in the meeting chat for those people that wanted to reach out directly. And we'll look to host these slides on our website shortly. And as Isabel said, we're looking to do this work in an open and transparent manner. And so we're really looking forward to your input as we go along. And we hope to see you on the 24th of July. Thanks very much.
See you guys. Thank you.
Thanks, Megan. Thank you.